We delight in the beauty of the butterfly, but rarely admit the changes it has gone through to attain that beauty. And that is the thought for today. My name is Priscilla, and welcome back to 5 Minutes Mental Health Therapy, the section that talks about everything and anything on mental health. Don't forget to like, share, and subscribe. In this video, I will continue on obsessive compulsive disorder. If you haven't watched the first video on obsessive compulsive disorder, check the description below. I will leave the link to the first video. Symptoms may come and go, ease over time, or worsen. Now let's discuss the next question people do ask. What are the risk factors? OCD is a common disorder that affects adults, adolescents, and children all over the world. Most people are diagnosed by about age 19, typically with an earlier age of onset in boys than in girls. But onset after age 35 does happen. The first is genetics. Twin and family studies have shown that people with first-degree relatives, such as parent, sibling, or child, who have OCD are at a higher risk of developing OCD themselves. The risk is higher if the first-degree relative developed OCD as a child or teen. The second is brain structure and functioning. There appears to be a connection between OCD symptoms and abnormalities in certain areas of the brain, but that connection is not clear yet. The third is environment. An association between childhood trauma and obsessive compulsive symptoms has been reported in some studies. The fourth is stress or trauma. The fifth and not the last is personality. The sixth and never the last is abuse in childhood. Another question is, what are the causes? Experts don't exactly know what causes OCD, but a family history of the condition may play a large part. Serotonin is a neurotransmitter that helps regulate mood and sleep and has many other important functions throughout your body. People without any known risk factors can still have OCD. OCD often occurs with other mental health conditions. 1. Attention deficit hyperactivity disorder. 2. Tourette syndrome. The third is major depressive disorder. The fourth, social anxiety disorder. The fifth, eating disorder. And the sixth, skin picking disorder. There are so many of them, but just to mention a few. In fact, about 90% of people living with OCD have another mental health condition, with anxiety conditions being the most common. Symptoms of OCD appear first in childhood for about half of the people living with the condition. Because symptoms often begin gradually, they may not be very noticeable right away. As a matter of fact, many people live with this condition for years before seeking help. Talking about OCD symptoms can feel difficult, especially if you have already tried. Maybe you shared an obsessive thought with a parent. They laughed, argued, and said, "Don't worry, that's not going to happen." But their loving dismissal did nothing to ease the thought. Or perhaps you tried explaining to a co-worker who frequently borrowed office supplies that you have to keep the items on your desk aligned in a certain way. But when they picked up a stapler to borrow it and set it back in the wrong place, you felt intensely uncomfortable until you put it where it belonged. Later, you heard them in the hallway talking to someone else about how weird you were. A mental health professional won't laugh or judge you. They will talk, listen to your symptoms with compassion. The next question is, what are the treatments? Patients with OCD who receive appropriate treatment commonly experience an increased improved performance. Treatment may improve an individual's ability to function at school and work, develop and enjoy relationships, and pursue leisure activities. The first treatment is cognitive behavioral therapy. It is known as exposure and response prevention. During treatment sections, Patients are exposed to feared situations or images that focus on their obsessions, initially leading to increased anxiety. Patients are instructed to avoid performing their usual compulsive behavior by staying in a feared situation without any terrible happening. The second is meditation. Noticeable benefits usually take 6 to 12 weeks. It is recommended that patients with severe OCD symptoms receive both CBT and meditation. The third is caregiver interventions. The fourth is self-care. The fifth is neurosurgical treatment. Approximately 1 to 2% of children are affected with OCD. Thanks for watching this episode on 5-minute mental health therapy. Please like, share, and subscribe. Check the description below to see what I will discuss in my next video. Bye.